Welcome to another episode of Innovation Somalia. I am your host, Abdul Ali. I'm coming to you from Columbus, Ohio. I'm really excited. Today's guests are
Angelica Rana Varela, and I'm the Homelessness Prevention Network Manager with Community Shelter Board.
Steve Skavensky. I'm the Chief Program Effectiveness Officer at Community Shelter Board.
Okay. So, just pretty much anybody jump in, just want to ask you the questions.
Yeah.
And tell us a little bit about what the Community Shelter Board.
So Community Shelter Board is a collective impact organization that's been around over 30 years. It's really based on the idea of a public-private partnership and a way to address homelessness. It was founded by Mel Schottenstein, Bob Lazarus, and Nancy Jeffries, who really recognized it's unacceptable to have people in our city who are without a home. So CSB funds 16 different partners in the homeless response, from homeless prevention, which I know we're going to be talking a lot about today, to emergency shelter, rapid rehousing, permanent supportive housing, street outreach for people that are living outside. So essentially the whole response to homelessness. And we are funded by a multitude of funders. HUD is our largest funder, then the City of Columbus, the county. We partner with CMHA. We have a lot of private donations and foundations that support the mission. And really, our goal is that for everyone to have a safe place to call home.
You mentioned names that I haven't heard for a long time: Schottenstein, Lazarus. Those were names that when I first came to Columbus, that we now it's Macy's, and Lazarus is a place to go for retail shop. So, what are the main factors that contributed to homelessness in Columbus, Ohio?
Yeah, absolutely. So I think one of the biggest messages we want to convey today is homelessness is a housing problem. It's a structural problem, and it has to be fixed with structural solutions. So we need more housing, and there are two main factors that drive homelessness. It's increasing rents and lowering vacancy rates. And Columbus is leading the country and the Midwest for certain in both of those. So we're continuing to see increasing homelessness because of our increasing rents and lowering vacancy rates. So that's the main cause of homelessness.
So Columbus, it's leading one of those or both of them?
Both of them. The vacancy rate.
Vacancy rate.
Yeah, vacancy rate,
okay.
Yeah. And so it's much harder to find an affordable unit, and I know we're going to talk a lot about that. And Angie has multiple examples of the current crisis, but it's becoming harder and harder to find an affordable unit in Columbus, Ohio.
How's the current situation look like?
Well, it has gotten worse over the past
How
few
so?
years. Part of the problem is Columbus is growing at a really fast rate, especially for Ohio, compared to other cities. So as we have people relocating to our area, there are less units available for the people who are already here. As rents rise, places where there was naturally affordable housing are now opportunities for owners to come in and purchase them, renovate them, raise the rents, and then people who have sometimes been in places for many years and had affordable rent are now forced to find a new unit in a climate where there's low vacancies in a very short period of time. So we saw this with Sandridge and with Riverview, where someone came in, they purchased the apartment complex, and then they told the residents that we're renovating, we're raising the rent, you have to find a new place to live. So that puts everyone in that complex at risk for becoming homeless.
So how do you find a balance to somebody that who is a business person, that who is who wants to do good for themselves, and versus folks that are actually living there? I mean, like, at what point that the city has to come in and say, okay, well, let's try to find a balance where these people that have been living there for a long time, and what would that look like if the city were to find a balance, and how long it will take for them to kind of house those folks?
Yeah, I think that there's definitely intentionality from the city's perspective around trying to find that balance. The counterweight to that is it's a open market, right? So someone can purchase a building and decide what they want to set those rents at. If there is specific funding attached, then oftentimes there are restrictions, right? So if it's a HUD-funded property, if the city has, put funding into the property, the county, there's a bit of a different conversation. But on the free market, it is a real balance. So I think there's been negotiation, there's been diplomacy, really trying to talk to business owners around having some intentionality around not finding the quickest path to give someone a notice that they have to vacate. But I know we're going to talk about the Homelessness Prevention Network,
right,
and a team that Angie has really worked with to activate around these situations.
Has the situation gotten worse?
Macro level, I can talk about our numbers of homelessness in the community. So HUD expects communities to do what's called a point-in-time count.
Okay.
And
what is that exactly?
Yeah, that is an effort in a single point in time to count every person who is experiencing homelessness in the community. So people who are literally homeless with nowhere else to go.
Okay.
So anyone utilizing emergency shelter, we know who's in the shelters based on the data. But then people who are living outside, living in cars, living in encampments, there is an effort to go out and literally engage and count them, find them. And so this is done every year, the last 10 days in January. We also know that we can't truly find everyone because there are people in abandoned buildings, there are people who, are intentionally removing themselves from engagement.
Okay.
But 2 years ago, we saw the largest increase we've ever seen in the community. We saw about a 22% total increase in homelessness.
Wow.
And a 46% increase in unsheltered homelessness. So these are people that had nowhere else to go and were not seeking shelter, so they were literally outside during one of the coldest months of the year. This past point in time count, we saw a very slight increase, which was good that it wasn't, the numbers that we saw 2 years ago. But as a community, we should be very concerned about the direction we're going because of those two main drivers, right? The increasing rents and the lowering vacancy.
Wow, that's interesting. Just to quickly on that percentage, do you happen to know the ethnicity of that percentage? What is the number for the immigrants? What is the number for people that lived here for a long time? What is the demographic basis?
Yeah, we can definitely drill down into that. We
Okay.
can't capture every data point. We try to be really intentional around not asking too many questions.
Absolutely.
But we can drill down into some of that.
Okay.
I don't have all the data for that now.
Okay.
But one thing that we really want to talk about today is the disparity in people of color who are experiencing homelessness compared to the general population.
Yeah.
It's highly disproportionate, and it's racism and homelessness is something that we have really tried to lift up in the community and in the system.
Okay. And what is the biggest misconception about homeless, that you'd like to clear up? What do you think of that?
I think the biggest misconception is that a mistake someone made caused their homelessness.
Okay.
Homelessness is a larger issue than just an individual crisis. I think most of us could say, one paycheck away from being at risk of homelessness,
Absolutely.
one crisis away.
Absolutely.
So homelessness is really a societal issue. It's in part, especially here in Columbus, about affordability and availability of units.
You said something very interesting. A lot of people may not know, but most of us are like 2-3 if we are lucky 2-3 paychecks away from homelessness.
Well, Abdul, if I could say,
go for it.
We've done this work long enough that we've seen doctors who've had to enter emergency shelter, computer engineers, people with good paying jobs. And we're seeing an increase in people coming into shelter with higher income. Now, not high income, but higher than we've seen in the past, which is another indicator that they're not able to afford housing in the current market.
So now let's dig into a little bit about the prevention and strategies, ways we can kind of sort of pinpoint what could cause somebody to go there, or how to prevent. So what are the steps that can be taken by the city to prevent someone from becoming homeless to begin with?
Well, I think we both want to lift up the work that City Council has done and Councilmember Favor, her Housing for All initiative. So I think there's really
what was the council's name?
Councilmember Favor. Shayla Favor. Yeah.
Favor. Okay.
Yeah. And she has really championed this work. I think source of income discrimination we can kind of unpack each of these if you'd like. Source of income discrimination, the city has an ordinance that makes it illegal for someone to choose not to rent to someone if they, have child support as a means of payment, or, Social Security, or, so it really makes, it kind of creates a level playing field where you can't pick and choose who you want to rent to based on their income. So I think that source of income discrimination, there's an ordinance requiring property managers to provide receipts, which sounds so simple, but if a landlord doesn't provide receipts to someone paying their rent, there's no way then that they can provide verification in court. And so a landlord, now has to provide that verification that someone has paid their rent. So then if there is ever, discrepancies or legal action, someone is armed with those receipts. And then the Angie, you mentioned yesterday the security deposit expectations too, of spreading that out.
Yes.
Well, what's going on there?
Sometimes, especially for people who have what we call barriers to housing, the expectation when you get into a new unit is that they now want like double the rent, like as a deposit, or they want a substantial deposit, and that can be a barrier for someone to get into housing.
Absolutely.
So now they are required to split that out over a longer period of time.
Oh, okay.
They can split it out over 3 months. They can split it out over 6 months, in order to give the tenant more time to.
Yeah, that's one less thing to worry about. Is that becoming like a requirement, or has it become a requirement for some of the landlords?
Yes, it's a requirement now.
So it's a requirement now. So.
And I think it's based on need, right? So if someone can pay the deposit in 2 payments, 1 payment, but if they need, to Angie's point, if they need multiple months, that's now an expectation that the renter is given that opportunity.
I know people say that we have affordable housing, but we have to take into account that what is affordable for one person may not be affordable for another.
Okay.
So we need affordable housing at all levels of income, including extremely low income households.
What does the current affordable housing look like right now? Does it only help like one section of the folks, or does it kind of sort of spread out across various incomes of folks?
What we really advocate for is the need for deeply affordable housing for people that are at the lowest income level. There is affordable housing, which also is, some people refer to as workforce housing, for people that are, employed, but, maybe lower paying work. But, we really see the need for the people we serve in that lowest economic bracket, and which would be 0 income to 30% of the area median income. And one of the real challenges is it's not economically viable for people to create the lowest type of affordable housing. So one of the things we're excited about is Zone In, the city's initiative to reform all the zoning in the city, because we need more density. We need build up, exactly.
Yeah.
And so with Zone In passing recently, kind of the first phase, we're really hopeful that will be a big boost to the housing that we need. The city has an affordable housing strategy that we support, but just the ongoing message is we want to make sure we keep the lowest income folks in our community in mind at all times.
Okay.
And if I could add something,
Yeah.
I would also say that those units need to be safe and decent. We have also seen, like what happened with Colonial Village, where we had a code enforcement issue that left thousands of people without a safe place.
Is that the
to
one on
stay.
South High Street?
It is on Livingston Avenue.
Okay.
And so they had to shutter that whole complex and find safe places for those people to stay. So we needed to be affordable, but also safe and decent.
But that must cost an arm and a leg, though, for the city. In term, the city will have to help out, right? Yeah.
Yeah, it's got to be a partnership,
Yeah,
right? It's
yeah.
got to be an entire partnership between city, county, private, business.
Right.
Because now the city is created the affordable housing bond and is really advancing all the goals there. But yeah, it's got to be a partnership.
Okay.
Yeah.
Good to know. For me, the way I'm thinking it is that always the city or the county or the state kind of sort of have to jump in to rescue all those folks that are experiencing issues and stuff like that. But yeah, that's an excellent point. You were part of the problem. Now you have to become part of the solution. So it has to be a partnership, and that's for sure. What is the existing programs in Columbus that exist, or maybe for the CSB exist that kind of sort of stay in the front of the line? We're still on that prevention to kind of sort of help out. Say, okay, well, we feel like we need to increase these programs. So can you talk about a little bit about the existing programs?
So that would be the program that I manage,
Okay.
the Homelessness Prevention Network. We have 28 community organizations,
Okay.
and each organization has a housing resource specialist.
Okay, so let's break that down. 28 organizations.
Yes.
Okay, so that's 28 nonprofit organizations.
Yes.
Okay, so give us an example, like some of them and some names. We just kind of sort of get an idea of, what their contribution is.
Absolutely. Our Helpers
Okay.
is one. Us Together.
Okay.
Chris.
Okay.
Jewish Families.
Okay.
Gladden Community House.
Okay.
Homes on the Hill.
Excellent.
Homes for Families. Equitas. There's 28, so
Okay.
No,
we're just looking for
several.
so at least I understand a little bit of that. I know Chris, and so let's talk about a little bit about the partnership and how that looks like.
So each agency has a housing resource specialist that's
Okay.
been trained in housing problem solving. Housing problem solving is the best practice for prevention, and it really speaks to the strength of the client and recognizing that they're the expert in their situation and that they can solve their own situation with a little bit of assistance. So it's really person-centered and just helping the person that's in a crisis kind of reorganize the chaos and come up with a plan that they can work to stabilize their housing situation.
So I'm on the verge of becoming homeless. So how? I guess I'm just trying to picture some of the stuff that you just said. I'm about to become homeless. So how can I help myself reorganize and reprioritize and not to be homeless, right? So where would you come in to kind of sort of say, okay, well, this is not a priority. This should be a priority. Otherwise, you will, you fall off the cliff.
So that's absolutely something that a housing resource specialist could help anyone with. And you can get in touch with the housing resource specialist by going on rentful614.com/solvers.
Okay.
And there'll be a list of all the organizations who are currently accepting referrals. And it's really a conversation. So I know in this space, a lot of times there is a power differential, and it feels like that person is kind of telling you what you need to do to get what they have.
Yeah.
And this is not that type of scenario. It's definitely person-centered, and it's a conversation where we're just empowering the client to solve their own situation. I think people have a lot more resources and ideas for how they can solve their crisis than they know. It's just that crisis brain, is just kind of in survival mode, and it's just kind of helping to kind of, okay, let's back up, let's take a breath, let's put everything in order, let's see what your options really are. Sometimes there's a little bit of myth busting that comes in. And we try to reestablish it so that they leave with a solid plan for how they can stabilize their housing.
Okay.
And I would add, in addition to someone going to Rentful 614, there are access points throughout the community. So an access point would be folks who have that kind of basic level of problem solving, but they have a referral process to these 28 organizations. And I know Angie's been really intentional about developing relationships with access points that really are a good connection to people who are struggling with housing, insecurity or at risk of homelessness. So Columbus City Schools Project Connect is an access point. And, they're kind of spread out geographically, right?
Is there like a job training is involved somewhere somehow on those folks?
For the housing resource specialists, yes, they're all trained in housing problem solving. So it is a certification in what they call rapid exit and diversion.
Okay.
And that is basically preventing someone from going into emergency shelter, or when someone is in shelter, getting them out quickly.
Okay.
So they're all been certified in that, and then they all receive ongoing training as well.
We got to talk about where mental health fits in all that, right? What are the challenges that mental health comes into play, kind of sort of gonna push you on the edge for becoming homeless?
Yeah, I think mental health is so important for someone's ability to stabilize in housing.
Absolutely.
It's not a driver toward homelessness. That is to say, like, it comes back to those structural factors, right? Like lack of housing options, inability to pay rent. But, all of our partners have relationships with mental health agencies, so they can do those connections for services that, again, are going to help stabilize people in their housing, are going to ensure, housing success as much as possible.
Okay.
But it's definitely a priority to make sure people aren't just housed, but they're provided with the service linkages that they need.
Host of things that come after you house somebody. Part of it is just maintaining the housing itself, right? Maintaining the job, maintaining all the requirement that other agencies that are helping you set forth for you. What kind of policy would you like to see from the city perspective, or from anybody that in a position to kind of sort of prevent or make your job a little bit much easier, not to deal with too many cases, rather than 2 or 3 a month versus right now it's more than that, I would imagine.
Yeah, last month we in the network we served about 500 households last month. So we are seeing a lot of people.
Yeah. And the local ordinances are to some extent mandated by what the state has passed, right?
Okay.
So
what is that?
So, like, if we come up with an idea of rent control, where you can't raise the rent above a certain level, that's not possible because of state laws and state rules. So when we talk about what the local government can do, we have to keep in mind what the state mandates are, right, or the state laws. But to your question around what locally, we want to continue to support all of the Housing for All work that City Council's doing. We want to support the affordable housing work that the city is planning and that the county is planning. And then that source of income discrimination. So I think an important thing that we want to make sure we all continue to focus on is support of the source of income discrimination, and wanting all communities around Columbus to adopt that so that everyone has the same opportunity for housing regardless of their sources of income. So that's a key thing that we want, and we know we've got the support from City Council. One of the other major things that we want to make sure, in light of the recent Supreme Court decision around camping being illegal for folks experiencing homelessness, is that we don't criminalize homelessness. And right now, we know in our conversations with the city and the county, there are no plans to criminalize homelessness. But some of our surrounding suburbs, surrounding counties up in Northeast Ohio, Northwest Ohio, there are conversations around passing anti-camping bans that would criminalize someone for experiencing homelessness. And so we want to keep that, keep the focus on getting people housed, not enforcing rules around homelessness.
Obviously, people are moving to Columbus. The rate of people coming to Columbus is just it's rapidly growing. What do you think that is?
Yeah, 45 people a day are moving to Central Ohio.
Yeah, why is that?
I think we've got the kind of the foundation here of government, university, business, and we haven't experienced some of the economic hardships of some of the other parts of the state. A lot of people who have said they've moved here think that there is more opportunity here for housing, which is something we have to have really candid conversations that if you're moving here for housing, that's one of our greatest struggles, right?
Yeah.
So but I think with all the business development, all the new companies coming in, people are seeing more opportunity here.
Yeah. Intel has kind of increased the number of folks that are coming to the city of Columbus, even though that's not part of the city. But yet, I think in somehow, some way, we interact that part of it. And the number of people that are moving here, and the existing folks that are actually here, what percentage do we find? Hey, I'm new to Columbus and I'm homeless, or I lived in Columbus for a long time and I'm homeless.
It's interesting because in our last report, our data showed that more people were from Franklin County that were experiencing homelessness. But we are seeing, people are coming to Central Ohio. So Angie mentioned Colonial Village.
Yeah.
And hundreds of Haitians who came to Columbus under false pretenses. They were trafficked here, believing that there were opportunities for housing, and those were all fraudulent. So we are seeing people coming here who, are believing there is opportunity. Now, our system has responded in a way to work hard to prevent those folks from going into emergency shelter. And very few have had to go into shelter. But it is a risk, right? When folks come to the community, housing is not as prevalent as they may have thought. And then there are, all those challenges. So we're working to I think the metaphor is maybe the bathtub, right? It's filling up with water. We don't have a drain. We don't have people moving out quickly into housing. So the bathtub continues to fill up, and we're seeing it overflow. We're not having enough outflow into housing as we did 5 years ago, 10 years ago, because the vacancy rate is so much lower.
I think building up can solve a lot of these issues. I guess the zoning has to come to the table to do that, to make a lot of it easy. Yeah. Do you have like a success story that you can share? Somebody that came across, their file in front of you, and you helped them, and now they're in better off, where you find them?
So for me personally, I don't serve clients.
Oh, okay.
I provide guidance and support to the housing resource specialists. So the housing resource specialists are the ones who actually do the work with clients.
Okay. What does that rate look like? The folks that come, or the folks that you refer to them to the specialist to help them out, what does that rate look like?
So we're currently doing an evaluation of that program. So we're in the process of kind of getting all that data so that we can report out. But I can say in the first 2 years of the pilot, the numbers were really strong at 97% of the families we encountered didn't enter emergency shelter.
Ouch.
Yeah, it's such a successful program, and we've seen prevention work be the most successful intervention, particularly since COVID, in a totally different environment with housing scarcity. if we can keep people where they're at,
Yeah.
that's the key to stability, right? Once someone comes into shelter or is living outside, it's so much harder to get them to come in or to get them back into housing. But if they can be prevented from experiencing homelessness in the first place,
Yeah.
that's the most successful piece. And I would say too, even though we don't provide services directly, there are multiple scenarios that I think we could lift up. I'm remembering the seniors who were put at risk the beginning of the year, 20 or so, right, that were all at risk of experiencing homelessness. And then couple of the partner organizations engaged with them, and none of the seniors ended up experiencing homelessness. Wow. So, yeah.
That partner was Central Community House.
Okay.
Yeah.
That's one of our 28
Okay.
partner agencies.
And if I can say, because we love to talk about these successes all day long.
Yeah, I know, right?
One of my favorite instances of a success story is a partner out on the west side named Jordan's Crossing. They have a resource center, and they were working with a couple. And now this isn't prevention because they were already experiencing homelessness, but a couple who was living in a tent in the woods nearby with a newborn baby. Ooh. And they came into Jordan's Crossing. They got connected with Gladden Community House, and Gladden was able to identify a family member in Arizona, I think it was Arizona, who would reconnect with them. So they bought them bus tickets to go back out to Arizona to live, and they've continued to remain in touch. Went from living in a tent with their baby to now reunited with family in another state. So that's the kind of, Angie talks about housing problem solving, creative thinking, what are your resources, who do you know? So that's a great example of that. And then we had funding during COVID to address pregnant women at risk of homelessness or in the shelter. And the funding that we used to do prevention for pregnant women was extremely successful. We saw a large dip in pregnant women who were homeless because so many were served in prevention. So we could talk about the success of targeted prevention for another hour and a half. It works so well.
I want to quickly ask, how did those people come about it? Like, how do you find them? How did those files come about your desk?
So what usually happens is one person reaches out to one of our partner agencies, and they say, I got a notice from my landlord that this is happening.
Okay.
And then we may get another call from someone else that lives there, and we say, okay, this is a trend.
Okay.
We need to see what's happening.
Okay.
And then we kind of, at that point, activate to say, okay, who's the owner, who's the landlord, what are their names? Is this happening to a large amount of people? How many units are we talking about? Or can we go on site and have an event and see if we can help people relocate if that's what's happening?
Gotcha.
Gotcha. As soon as we have an inkling that there may be a major issue where people are going to have to be relocated, we try to address it as soon as possible.
I think the whole key is the word network. It's the Homeless Prevention Network, and it's part of the Central Ohio Stable Housing Network, where the city has funded these 28 resource specialists. So that idea of network has really, I think, caught fire.
Excellent. And I mean, there's so much you can get done networking because you never know who you're going to meet. Yeah. How can a regular or a business owner, if I'm a business owner, how can I help?
So Angie mentioned Rentful 614, the website, which we definitely want to make sure your listeners and viewers have access to that information. I think for individuals and businesses to know the resources, to know where to reach out to. We want to get to the point where we can do the housing problem solving training for the general community. So individuals, businesses, barbers, bartenders, grocery clerks have a basic knowledge of how to direct someone in a housing problem solving conversation. And then we want to increase opportunities for what we call flexible funds. So if someone has a need, like a car breaks down, and they have to make a choice, fix my car to go to work
or pay my rent.
There aren't general funds that can help you fix your car. So that could be an opportunity to begin contributing to flexible funds. So we'd be happy to talk more about that as an opportunity. But yeah, I think those are the things that come to mind for me.
There are some folks that they don't seem that they're having a trouble, or they don't seem they need help because they don't speak of, because there's a stigma goes along with that. So let's talk about that a little bit, the stigma that is a part of it.
Yes, so I would say the trauma of homelessness is so great that when we're thinking about stabilizing housing or giving opportunities to our neighbors, our friends, our family members, we really need to be open-minded and compassionate, and be willing to think outside of the box.
And there's this idea of cultural humility.
Yeah.
So rather than just being competent in understanding other people's cultures, it's being humble and really walking in those shoes and understanding, so that, you know, someone coming to you for assistance feels no judgment. They feel empathy. And so we try to have training and conversations around being culturally humble.
Yeah.
But yeah, creating a safe space, I think, is really the goal, so that we know those are barriers, cultural barriers, where people don't want to ask for assistance. And it's like the HPN is doing, I think, creating partners like Chris and us together and our helpers who have a connection to that community too.
Okay. I wanna talk a little bit about the specific organizations that you guys serve. So if you had to break it down, in is it all for homeless, or is it like other type of community service that can kind of sort of, because if you think about it, they all touch one another.
Absolutely.
Yeah.
So I would say just within the network, a lot of the organizations that we partner with that have a housing resource specialist also provide other services. So a great example of this is Jewish Family Services. They have employment assistance, they have financial empowerment. We also partner with Columbus Literacy Council, where they teach English as a second language. They have programming for minors. So a lot of the organizations that we're partnering with the housing piece, they also have other services that they provide, and they're able to refer to each other. And then we additionally have partners like Jordan's Crossing, for example, St. Stephen's, who have a pantry on site. Compass, we have Community Development for All People. So a lot of our organizations already have those resources and are already working in the community in those ways. So when someone comes in and they need to have a conversation about their housing, if they find out that they're also food unstable, they're able to say, well, you know, we have a pantry right across the street. We can go over there and you know, get you together. So that's one less thing you have to worry about.
If one partner has a pantry and another partner has childcare, they can make sure all the needs are being met for someone. So that's so important. And then CSB, Community Shelter Board, we really try to focus too on our system role and our system leadership, connecting to other systems of care, because we recognize we're the homeless response system, but other systems can play a role in that prevention, right? So linking with children's services, and so we have a partnership to provide homeless prevention to folks that are seeking services from children's services, or folks who might be at risk of losing their kids but need that support. So children's services, we partner with the justice system, with Franklin County, to really find ways to divert people from going from jail into the shelters, and they've got a great diversion program. We're working closely with the Office on Aging with Franklin County we have an alarming number of seniors that are becoming homeless, experiencing homelessness. So the Alcohol, Drug, and Mental Health Board, it's just that system to system response that's so important. And that's also how we can try to try to address those disparities we talked about, right? With, in our most recent report, everyone will see that 94% of all families in the shelter are a single mom head of household. 94%. So that number should be a crisis for our entire community, that 94% of our families are a mom and kids. There's, so really trying to recognize, why is that the case?
Yeah.
The institutional and structural racism that folks experience through evictions, through incarceration, all of those, disparities and drivers of homelessness and racism.
Who should have that discussion?
Yeah, well, we're happy to have it, and we need to have it, but we're bringing that in conversation with the city, with the county, because we recognize, I think everyone recognizes, and if they don't, that's why we're talking about it.
Right.
So those are conversations we have with our elected officials, and really trying to find ways to address that. I think the work of getting access points that are in new communities is one way. We're doing a program now where we're giving cash to families to help them get out of shelter. That's an equity tool to also try to address that. So I would say it's ingrained in everything that we're doing.
So what is the responses from elected officials? What are their responses?
Yeah, I mean, I think they recognize too that it's unacceptable, and we have to address it as a community.
What advice do you have for somebody that is on the brink to become homeless, and what advice do you have in generally to kind of sort of smooth the transitions or maybe keep them where they are?
So I would definitely say to look on the website. I know that we've already given it twice now, but I will give it again. rentful614.com/solvers. And that's definitely if you're kind of out of ideas and options, and you just kind of need someone to listen to what your situation is and maybe come up with some different ideas. So that is a great resource. I would also say, how we talk about humility and the trauma of homelessness, to not be afraid to ask for help.
What kind of help?
From your friends, from your family members. It wouldn't have to be permanent, but just a temporary, any alternative, safe alternative to emergency shelter is going to be best for you, and especially if you have minor children. We don't want kids to have that early life experience of being in an emergency shelter.
And always having open conversations with your landlord, because if by the time it gets too far along, your landlord is going to be ready to proceed with eviction. But if you can have those open conversations as much as possible,
as early as possible.
I love that. Thank you. As early as possible. Whatever you can do to prevent it going to court. And this idea of never worrying alone. Utilize support. Utilize resources.
Absolutely.
That's why they're here in the community.
I'd also add, if you do have a date in eviction court, another one of our partners, Community Mediation Services, says you should always go to your court date.
Okay.
You should always go. So one thing they see is people just don't show up. It's kind of, that freeze response to a crisis. They just don't. I'm not going. It's not happening. They say that you should go. And there are resources at the courthouse as well. So if you can have some kind of representation when you go to eviction court, you're less likely to actually be evicted. Or they may be able to negotiate to give you more time to get out of your unit and things like that. So it's important that you go to your court date.
Let's talk about the event.
Yes. So on October 8th from 2 to 5 at the YWCA downtown, 65 South 4th Street, CSB is convening the Community Summit on Homelessness.
Okay.
And so for the past 18 months, there has been a evaluation of our homeless response system, the factors that are affecting our community with housing, with workforce, all the elements of our homeless response. And so there's been a steering committee that's met with a national consultant to really lead this assessment. And on the 8th of October, we're going to have a community conversation around what are the findings of this assessment? What are the predictions, the modeling of where homelessness is going in our community if we continue on the current path. On that same token, there's a model of impact that's been recommended by the consultant and the steering committee has endorsed to show how we can reduce homelessness in the community and the investments that it's going to take. So we believe this is the opportunity to rally around what's the community assessment. It's a community issue, and it's going to be solved by everyone working together. City, county, faith leaders, business, and Community Shelter Board is ready and positioned to lead along with our continuum of care, but it's got to be a community effort, and we want everyone to know where we're heading if we don't make any changes to the current funding system, and where we can go if we make some investments and actually reduce the number of people who are expected to experience homelessness. So October 8th, we'll have elected officials there, we'll have funders, partners, stakeholders, community members, and we want everybody to come and find out exactly what our response needs to be.
Okay. Yeah. October 8th, 2 to 5 p.m., yes. 65
South 4th Street.
South 4th Street, yes. Downtown.
Yes.
Excellent. Definitely, I'll put that on my calendar. Is there anything else you want to add to it?
Columbus has an opportunity here to change the direction that we're heading. We're at a critical point, and we've got to go the right direction, because if we continue to see a homelessness increase, we'll go so far that it'll be virtually impossible to come back.
Yeah.
So
we don't want to be like San Francisco.
Exactly. That's exactly right.
Yeah.
So I believe that we've got the hope and the optimism and the right partners and the right people doing this work. We want to end with with positivity and not the gloom of all these predicted numbers. But
no, I mean the work itself that you guys doing, just the fact that you guys take the time to come here, that itself is a positive, and you guys show that you guys care, and we're your work is taking you, the upcoming events, and the folks that you guys bringing together, that itself just shows the positivity that we are in a crisis mode. 94% is still ringing in my head. That needs to change, and hopefully these are the discussions that needs to take place.
Yes.
And I think it's happening. Well, I appreciate your time. Thank you so much for taking the time. This has been just a delightful conversation, informative conversation for me specifically, and I hope the audience feel the same. And we'll leave it at that.
Yeah, thank you for the opportunity.
Thank you, Angie.
Thank you.
Thank you, Steve.
Thanks.